We will start now with the session.
Yes.
So, good afternoon, all. I, Mr. Professor VESCOP, welcome you all to the orientation program on artificial intelligence for healthcare in pursuit of innovation for Atma-Nirbhar Bharat using promising technologies. At the outset, I would like to welcome our distinguished speaker, Padmashree Awardee, Dr. Natarajan from Aditya Jyot Research Foundation, Dr. Vijayalakshmi, Vice Principal, VES Institute of Technology. We have our teaching staff. Many teachers have joined from VESCOP. I welcome them all, and I welcome all the student participants. In the pursuit of our vision of creating competent pharmacy professionals to positively impact healthcare of the society, VESCOP is coming up with one more milestone activity for the budding pharmacist and pharmacy professionals. Artificial intelligence. It is a new buzzword and has immense application in the healthcare field. The role of artificial intelligence in healthcare has been a huge talking point in recent months, and there is no sign of adoption of this technology slowing down. AI in healthcare has huge and wide reaching potential with everything from mobile coaching solutions to drug discovery falling under the umbrella of what can be achieved with machine learning. Applications of artificial intelligence in healthcare are really seen to be endless. In order to make pharmacy professionals acquainted with it, VS College of Pharmacy, in collaboration with VESIT, is launching a 30-hour certificate course entitled AI for Healthcare in Pursuit of Innovation for Atma-Nirbhar Bharat using promising technologies. And to introduce to the students to this course, to give an overview of AI field, we have planned today's program. To make this program happen, we have a very great support from our honorable trustee, President VS Society, I mean Vivekananda Education Society, and trustee in charge VESCOP, Shri B.L. Bulani ji. It is his vision and farsightedness that has led to VESCOP venturing into all innovation oriented activities and taking up new ventures like this. Also, a very special mention, without her, nothing is possible at VESCOP. Our beloved principal madam, Dr. Supriya Shide, she has motivated, and me and Neha madam are guided at each and every step by her while we are bringing this program in reality. So with this short note, I would like to hand over the session to Dr. Neha Chabra, Assistant Professor VESCOP, to take it ahead. Thank you.
Thank you, Pradnya Madam. It is my absolute honor to introduce Padmashree Award from President of India winner and Guinness World Record holder, Professor Dr. S. Natarajan. Sir is a vitreoretinal surgeon since 1984. He is a charter member of Retina Hall of Fame and has done more than 60,000 vitreoretinal surgeries and has given more than 2,500 invited guest lectures. He is a Guinness World Record holder for screening maximum number of DR cases in urban slum, Dharavi. He has authored more than 4 books and has more than 100 peer-reviewed publications. He has touched 8 million lives in slum, enumerated 200,000 slum houses through not-for-profit NGO Aditya Jyot Foundation for Twinkling Little Eyes. Sir, we welcome you. The stage is all yours.
Thank you very much. And thank you, Dr. Pradnya and Dr. Neha Chabra, and specifically Dr. Vijayalakshmi, and also your trustee, Mr. Bulani sir, who really, I'm impressed with him. At the age of, now he should be 94, I think, that I met him in 1991 and 92. And at 92, when I told him, you have to come, he was saying, I'm old, but he came. And he not only came, he spent a lot of time. So I'm very grateful. I don't know whether he's on the Zoom now, but maybe you are doing YouTube, maybe he's there. But I'm very happy. Only thing I didn't understand, something you mentioned about the program, Pradnya, to encourage a pharmacy and pharmacists. What is that? I didn't understand the program. It's a Government of India program?
No, it is, sir. Nowadays, it's an era of artificial intelligence, and you must be knowing that the application-based, app-based technologies are taking over, because there is a lot of data generated nowadays, and the data analytics and everything, for that various programming tools are coming up. And pharma industry also is using these tools, and thus having knowledge about this technology is very much essential and can give an upper edge to the students, because the conventional syllabus does not cover artificial intelligence
Okay.
and its role in healthcare, because we all are pharmacists. Pharmacy as a professional, when we see, so for the pharmacist, I mean, in the coming years, artificial intelligence can be a very integral part and can give them an upper edge. So we really do want to give something to our students on these lines, and that is how we are launching a 30-hour certificate course, which
Okay.
will give them introduction and flavor of that field, which is missing from the conventional syllabus. And that is how we have come up with our principal, madam. Yeah.
Sure. Very good.
Yes, sir.
So can I share my screen? I think I should be able to share.
Yes, sir.
Yes, I'm able to share. Yes.
Yes, sir.
So I'm really thankful to Dr. Vijayalakshmi when she called me, and I could present, because AI is very close to me, and yeah. So artificial intelligence in healthcare and community ophthalmology, I put it, because I'm working on AI in ophthalmology. So can machines think? So can machines think? That's what he was questioning, and that's how it's like a research question. Alan Turing in 1950, and that means around 71 years that these things are going on. So computing machinery and intelligence in the 1950, the Turing test established the fundamental goal and vision of artificial intelligence. You can imagine that the people are thinking, and it has taken so much years. Even today, AI is still in infancy, even though a lot of places it is being used, including ophthalmology. I'm one of the pioneers in the world to use AI. And so AI is a branch of computer science that aims to answer Turing's question in the affirmative. It is the endeavor to replicate or simulate human intelligence in machines. So jokingly, I keep telling everybody, when we want to do AI, we have to have I. I is the intelligence. So I think we should know what is the intelligence, which God has given us, but we have to use it. A machine that thinks like a human. Many humans do not think like a human, and that's the problem. And that's the reason many of us have to use AI. So narrow artificial intelligence, which is a weak AI. You have the Siri in the mobile phone, like the Apple, what do you see here, where a Siri is there, and you can talk to them, and then the Google, then the Amazon Alexa. There was a Tamil movie taken on the use of Alexa. I'm sure some of the students may be using Alexa or a Google Assistant. And I think it's amazing. I'm amazed with that. And I think in a way it's very, it actually interferes in your life. That's what I would say. So you should know how to use it and how to be not dependent on it. And artificial general intelligence, which is a strong AI, where you have this Skynet and her. So artificial intelligence enabling machines to think like humans. There's a scientific movie called Robot, where superstar Rajinikanth acted, the director Shankar did, and it's like a enabling machine to think like human. And that machine, they even made such a story that they even wanted to make a baby. So I think artificial intelligence is like making think like human, but still, yeah, I think I don't know whether you understood from the movie also, and as well as in life, there's a possibility that AI can take over you. Well, there is a possibility, because it keeps on learning every day by adding whatever images or whatever you're doing. So machine learning is that training machines to get better at a task without explicit programming. That means the machine every day collects information on, particularly on it is like you should have heard of face recognition, where China is the most advanced in face recognition. And that means every day they take photographs of the same person from top, bottom, side, If you're using iPhone and if you're using a face recognition in the iPhone, it will take photograph in all angles. So it will take this way, take that way, to profile like that. And deep learning using multi-layered networks for machine learning. So in ophthalmology, and same thing will apply to even pharmacy or pharmacists, AI is seen to have unlimited potential to perform many tasks as well as even much better than humans. It is seen to be very good as diagnostic tool, grade the severity of a disease, early disease detection, screening tool, and prediction of the evolution of a disease. So the main thing I always wonder, why can't we incorporate artificial intelligence in the telephone system? But that means when a patient is asking for a medicine to even a pharmacist, there should be AI incorporated, because you should know whether the patient is asking, ordering online properly with a proper prescription or not. And same thing here, with a particular type of complaint, which physician to go or which specialist to go, that software itself should be able to guide. And that's what is my dream. So that's because of the collection of various data, this prediction of evolution of a disease is possible. I'm taking diabetic retinopathy as a example where AI has been used a lot for the last 20 years, I think. Maybe last 5 years it's going well. And we hear one of my friend, Dr. Rajiv Raman, and then Daniel Ting and Dr. Tin Wong from Singapore have made this artificial intelligence deep learning in ophthalmology. And there's a question in, can artificial intelligence make screening faster, more accurate, and more accessible? Artificial intelligence and optical coherent tomography imaging, deep learning for detection of diabetic eye disease, development and validation of a deep learning system for diabetic retinopathy and related eye disease using retinal images from multi-ethnic population with diabetes. I don't know how many of you know, the Google artificial intelligence has come out. By looking at the retina pictures, it can find out whether it belongs to a male or a female, which is not possible by any human, any specialist like me. When I look at a retina, I don't know whether it's a male or female, and that the artificial intelligence is able to find out because of the added information given to the machine. And this is in JAMA, development and validation of a deep learning algorithm for detection of diabetic retinopathy in retinal fundus group. And this is actually from the Harkness Eye Institute, Columbia University. And in this, evaluating retinal fundus photo from the adults with diabetes, an algorithm with the deep machine learning, where could lead to improved care and outcomes compared with the current ophthalmology. That means an eye doctor assessing it. Many patients in India lack coverage and access to effective quality care. That's what the International Diabetes Federation says. 77 million diabetics in India in 2020, and this is expected to reach 150 million by 2040. Out of this, 16 million will be affected by diabetic retinopathy by 2050. And diabetic retinopathy has a significant impact on people's quality of life and was associated with deterioration in physical well-being. Besides, the burden for people with diabetic retinopathy is also responsible for significant healthcare expenditure. So the problem of the statement, the delay, lost follow-up, missed or postponed, increase in probability of vision loss, and diabetic retinopathy means progressive damage to retina, eventually leading to blindness. And no explicit symptoms until reaches an advanced stage. So if detected early, vision impairment can be prevented. And the existing diabetic retinopathy screening process, the lack of trained clinician, moreover, the screening process is time-consuming. And diabetic retinopathy is an important public health problem, and retinal photography is a validated, simple, and effective for diabetic retinopathy screening. And once you detect a diabetic retinopathy, they may need treatment as an intravitreal injection in the eye, or laser treatment, or surgery. And the diabetic retinopathy screening challenges programs are challenged by issues related to implementation, availability of human assessors, and long-term financial sustainability. In order to overcome practical challenges like remote location, transportation, and poverty, there is the need for improvement and practical aspects for remote ophthalmic diagnosis and care. Recent studies indicate that AI has astounding potential to perform much better than human being in some tasks, especially in the image recognition field. Because none of us have the patience, even though we can do it. So that the AI can do. Even though there's a one question, will AI replace human being? No. We have to be the master of the technology. That means AI technology has been introduced by the human using the computers, and computer can have more knowledge than you, but still, I think if you should know to be a master of it. That means it is like a car. You have an automated car. In spite of that, I think there should be some human control for where the car to be parked and where to go. Even though there are now the driverless cars are coming, and I think AI will be there, but there will be somebody behind that sitting somewhere remote and monitoring. That means AI can be used even for surgery one day, using remotely by doing robotic surgery, and for which there has to be a master. A surgeon like me should master the robotics, should master the technology, and should also master the AI, so that the man behind the machine is very important. So these automated techniques for the diabetic retinopathy or anything in pharmacy, all that we have to be the master behind it. So we have a smartphone-based retinal imaging, which is an efficient and cost-effective method for screening, and the device can help in delivering eye care services to underprivileged population groups in resource-limited or remote areas. It is an ideal platform. So the AI, and we can use it in telemedicine-enabled eye health. Telemedicine is now during the COVID last year, a lot of patients were afraid to come to hospital, and a lot of doctors did not open their clinic. But every patient has a video phone or a Zoom where they can come online and send their images before, and then also can check. But the tele-ophthalmology, where there's a possibility to examine the eye also using telemedicine technology, but in a difficult in everybody's house. But the patient can go to a nearby optometrist where there's no crowd, so that we can do a teleoptometry, teleophthalmology. That means using AI, using telemedicine, we can still able to guide the patient almost 90% as though you're examining the patient. It is possible for examining a patient with a physical look, but feeling the patient is going to the problem in telemedicine or AI. And AI has the potential to significantly enhance and impact on screening programs for vision improvement and eye diseases, and thus to impact on global blindness. AI-based grading is available. It's all based on learning this machine learned technology. So the process flow is screening can be performed using portable equipment, and the cases with a referable diabetic retinopathy can be referred to an ophthalmologist for further management. And AI is based on deep learning technology. It can be used to detect referable case of diabetic retinopathy. So advantages: increases accessibility of screening program, low resource areas, enable non-eye trained clinician to conduct opportunistic screening without the need for trained specialists. That's where I see the role of AI in every field, where each, for example, the pharmacy, the professors here has to go through the AI, how it can be used, and where everywhere you don't need the pharmacist to manage, but the AI can manage. But there should be somebody monitoring overall, so that there is no human error or a machine error happens. So that means I follow this. My teacher taught me: check, cross-check, counter-check, and recheck, and savings to the health system by providing more targeted referrals to eye specialists. Real-time reporting of results and referral recommendation reduces patient anxiety, reduces documentation error, reduces difficulty recontacting patients. So is this a sustainable screening for a solution for community screening in India? It's a Stop Blindness initiative. Stop Blindness stands for screening through teleophthalmology for prevention of blindness. I believe every Indian citizen deserves an eye checkup. So this is what I meant by using the AI, where you take a mobile phone, particularly iPhone, fit it onto a Remedio. I don't have any financial interest. Both can be charged, and then the person can take it and go use it, and then bring it back and recharge it. It can be mounted on a suitable bike. So we are the first in the world use the mobile technology, taking this phone with the camera on the mobile motorbike, and then using the AI, where a patient can be told immediately that you are having retinopathy, but you don't need to go to eye doctor. But you are having a severe retinopathy, you have to go to eye doctor. So it is a chargeable instrument. It's a portable, low maintenance, and I can train any peon or a boy or a girl to use this. A job opportunity in rural India, in slums, and easy retrieval of data at reading center. And that's what we have created with VESIT, thanks to Dr. Bulani and to the Department of AI VESIT, where and Dr. Nair, the principal, there we have got a VESIT Aditya Jyoth Innovation Center in the 5th floor, I think, of the center. And I love to visit campus because I'm a staunch follower of Swami Vivekananda, and I love to come and see the life-size or more than life-size Swami Vivekananda statue there. So this is a screening device we require because we have only 1 out of 1 lakh eye doctors. We have only 45,000. We need 45,000 optometrists, but we only have 8,000 optometrists, and we have about 23,000 ophthalmologists and less blindness preventing surgeries. It is vital that optometrists take charge of primary eye care and semi-skilled worker take charge of screening and job opportunity. And even in this diabetic retinopathy screening, all the pharmacies have a role. How? When a diabetic person comes to the pharmacy and then tells that he wants diabetic medicine, there has to be a counter thing where the data can be acquired and that AI can be used and find out whether that person has taken eye checkup or not. The reason is you are helping the patient and not taking the data for your own benefit. And accountability, proper training of the semi-skilled worker, proper and regular monitoring, ease of workflow, and we can finally have the diagnosis and treatment, and also regular intervals of outcome and visits. An expected outcome, early detection and treatment after screening can reduce the prevalence of diabetic retinopathy, even in remote areas, reduction in the economic burden among poor and illiterate people, opportunity for semi-skilled workers. It will help to improve overall health of the population. We use the Meteos AI logarithm and decided to have a referable diabetic retinopathy using the logarithm. And this is a boy, the 2 boys who are there behind the phone. They are the boys who are working as a peon, and later we have trained them. And that means a non-skilled worker we have taken and given them a one skill like taking a retina photograph. And this we have published in the JAMA Ophthalmology, which is a high-impact journal where there had the maximum number of. You can see how any person can handle the phone and take the photograph of the retina without an eye doctor. And this is the first study validating performance of an offline AI algorithm, and the sensitivity and specificity of AI in detecting referable diabetic retinopathy was 100% and 88.4%. And these are the comparison with the other AI studies. We still rank the highest in the number 1 in the world. And an offline algorithm does automatic grading, and offline for community referable diabetic retinopathy. So general practitioners, primary care physician, other caregivers can easily diagnose the primary care physician, other caregivers, including the pharmacist, can easily diagnose referable diabetic retinopathy. What it means is you need this equipment, you need training, and then you can do it. Because you're not going to interfere with the treatment or with the diagnosis. Everything is done by offline, which can be monitored by an eye doctor sitting in Vadala or in a reading center. That means ophthalmic image reading center at the VESIT, which we are creating. So the disadvantages, a negative AI-based finding may give the patients a false sense of security about the totality of the sense of security of the totality of the eye status. Emerging evidence from the Joslin Diabetic Center shows that diabetic retinopathy lesions in the peripheral retina are highly predictive of which patients will develop proliferative diabetic retinopathy, the blinding form of the disease. And a community diabetic retinopathy using fundus on phone, we came on the Guinness record for doing the highest number of screening, where we had 15 cameras, 15 observers, and which has been done. And we also done a community where there's 649 patients, and of which 53 were diagnosed diabetic retinopathy, and they were treated free. So to reiterate, WHO believes that 80% of all visual impairment caused by diabetic retinopathy can be cured with regular screening and early detection. And diabetic retinopathy still remains a leading cause of irreversible vision loss. Asymptomatic patients will not show up clinics, and advances in technology and need of the time to cope with the growing burden of diabetes and diabetic retinopathy. And artificial intelligence, automated function, accessibility, affordability, and efficiency of service, and most research required. So artificial intelligence for screening will be equal to accessibility, affordability, and efficiency of service. So, and I want to say that innovation distinguishes between a leader and a follower. Dr. APJ Abdul Kalam, the president, the former president of India, was a very good friend of mine before he became one, because he hails from Rameshwaram, and I hail from Madurai, a few kilometers from the Rameshwaram. And he said, anyone who converts a challenge into an opportunity through innovation creates wealth. He or she indeed is a leader. Are you? So I'm questioning this to the professors who are there in the Zoom and the students here. Are you a leader in this way, where you convert a challenge into an opportunity through innovation and will create wealth? How do you create wealth? So I run a charitable clinic in Dharavi, in what do you call in Chunambati, and all the slums, Dahisar, Govindi, and all the slums of Mumbai. And we use this artificial AI. We got a grant from Tata Foundation, Bajaj Foundation, and they have supported us. Like that, we all, pharmacy, the engineering, and I, and optometry can join together and use the challenge, convert the challenge into an opportunity through innovation, create wealth for yourself. So I want to question all of you that do you know how to create opportunity and do this, use the AI? And second, don't be a slave to the technology. And I think if you have seen, even though AI computers are available from 1950, now the computer is available in a mobile. I can do everything in a mobile, including retina screening, including ordering a drug, including ordering a food, movie, and anything. I mean, you can imagine, including your Paytm, Google. So when Dhirubhai Ambani quoted that "Dunia mutti mein," I always wonder what he meant. But I think he was having a foresight. And now his grandson, Mr. Nikhil Meswani and Mr. Mukesh Ambani, is doing the Geo, and they can say that you can download movies in 3 seconds. I don't know which is happening, but I use the Geo internet, and now Madam had an internet problem. In spite of all the technology, Google, I'm publicly mentioning this, Google fails in India and in Thailand, which is published in Wall Street Journal, because of internet. Internet doesn't work. The Google AI does not work. That means we take photograph in a village, maybe in Malvan, and then you want to send it to Bombay, and you need internet. That means you need a high-speed internet, because nobody has patience that I will sit and wait for 1 minute to come. No, in 1 second, I think I can see all of you, the students here, and you can always. I'm just only giving an after thing for the talk, so I welcome questions here. But I'm just giving my idea, which my Dr. Fellows have not put the video, and maybe I will search a video. It's about a few seconds video of how I'm using AI in diabetic retinopathy screening, which Dr. Vijayalakshmi has seen, I think. I will search that. And in the meantime, Dr. Pradnya or Neha can ask questions, or even student. I welcome students to ask me more questions, but Pradnya looks like a student, not like a faculty.
Oh, thank you, sir. Thank you for your kind words. I'm here in VESCOP from past 10 years now.
Okay.
So, yeah, more towards faculty side. Yeah, students, we keep the session. I mean, we announce the session open for your questions, and we have the first question from Mr. Habil Hirkani. Why is the algorithm offline? The world record proved scalability, meaning. Just a second, I am not able to.
Yeah, the meaning huge amount of data can be generated.
Yes.
Wouldn't an online version allow the algorithm to access a larger pool of images, data like self-driving cars, for example? In this instance, ultimately making screening more robust. I agree. Habil is the person who's asking the question, and I agree with you. But what I mentioned about Google failed in Thailand and India is, and that's why still the Google wants to finally encash every technology into money. And that is why Mr. Sundar Pichai celebrated his 50th birthday day before yesterday. I wished him. But I want to tell you that he is the most rich man, but he's from an ordinary family in Madras. And like me and Dr. Vijay Lakshmi is a Tamilian, and we are proud of that. But that doesn't, I think, caste, creed, religion apart, region apart. What I want to tell is, for using AI, you need your own intelligence given by God, which is there. Everybody has it. You have to sharpen it. And that's why Stephen Covey says, sharpen the skill. The skill is there. So the question, coming back to your question, the offline AI we have used because in India, internet fails many times. I'm not blaming the government. Don't mistake me. I'm doing all my programs using internet. Now, right now, all of us are doing a successful program through Zoom and also live YouTube, Facebook. So, as you rightly said, if you have an online, you have an online AI where you said you can use the car. You imagine suddenly when you're on the car and then online the internet drops. What will happen to the car? Can you imagine? I don't know what will happen. I don't know whether you can stop the car or whether the car will stop in between. The cars behind will bang you. I don't know. It's an imagination, but I'm saying that can fail. I don't know whether you realize, using this internet, they did a surgery, and I think that unfortunately, I think something could not be controlled, and then I think the machine jammed the thing, and the patient died. I think, and that is where we cannot do any technology without testing many times. So luckily, I'm using offline AI only for diagnosis. So the diagnosis can be done by offline AI. Maybe even if the delay, we find out it's the wrong diagnosis 1 day later, or 1 hour later, or even one week later. Even if it is a cancer, you will not lose the patient unless you're doing heart attack. You're diagnosed heart attack.
Yeah.
Now, which company? iPhone is working with um, uh, uh, Stanford on AI, where they are actually coming out with a watch that will pick up the pulse rate and read the ECG without doing an ECG, compare with the data stored with the ECG, and that will diagnose. You have a fibrillation, or you'll have this and that, whatever. But again, it will be connected to the ophthalmologist, to the cardiologist, and all are require internet. And I think in India, I'm not telling we are far away, but I think we have to have a robust internet. And I remember Google's Sundar Pichai came to India in 2014, I think, after our Prime Minister took over that time. In 2014, he has given not AI, internet, free Wi-Fi in all the railway stations in India. I think not all, so many thousand railway stations in India. I am not using train, but I want to know from the student, is it working properly? I don't know.
Works.
I think internet sometimes slow, and they will say, I think Dr. Vijay Lakshmi started saying it is slow. So I'm not against it. So coming back to your question, we used offline because we will never fail the diagnosis, and we have proved that referable patient, that means a patient with diabetic retinopathy who needs to see an eye doctor, even when the image quality is bad, when the internet is not there, electricity is not there, it will diagnose in 28 seconds. That means you take the picture, apply it on the AI, which is what I'll show the video, and it will give the answer in 28 seconds, saying that this patient needs to go to eye doctor. There's 90 patients who can go home, come back 6 months later. So an ordinary person in UP or Maharashtra, knowing Marathi and Bhojpuri, no need to know Hindi and English or anything. They no need to read also, because they know which one to press. It will tell you whether you have to go to eye doctor or not. So I hope I have answered your question. The same data which is available in the phone, later it's immediately using whenever you get the internet, it will come to the reading center, where we are planning to do a big mega computer storage in VESIT, where the entire India's, this is a secret which I had, I'm unfortunately publicly telling, which I want to do. But the problem is, there's a lot of copyright issues, there's personal data issue, and the government of India is also telling we are going digital health. That means there's a possibility all the data can be compiled and sold to a pharmaceutical. So I'm telling a wrong place the truth. And already there is a genetics testing by an Indian origin girl with an American somebody. There's I forgot some $1 million. It's coming as a movie now, and
Yes,
that
yes.
famous actress is acting. I
Yeah,
forgot
yeah.
her
That
name.
startup, I think that startup which they found was fake afterwards.
Correct.
Healthcare. Yes, yes.
And then they did a reporting, whatever. What I'm trying to tell, when there is a good person, there will be also a bad person,
Yes.
and that is there from Mahabharata also. So you had a good karma, bad karma, whatever your religion. I'm saying whatever you want to follow. When there's good, there's always bad. So good weather, bad weather. So I think coming back to the question, it is a double-edged this
Sword.
thing, and same time we need regulation by government. We need law so that we know what to use, what not to use. So the question here is, we can use online AI and it will be chargeable. So somebody has to pay. All that is there. Here, I am collecting the funding and I am giving it free to the people. That means I take the money like from the government or an agency and give it. Similarly, I want all of you here to think of a project where you can involve me. I'm happy to be working honorary here. And we should do something back to India in the sense through pharmacy or pharmacist. So I hope I have answered the question. The person, what do you want? Habil, you need any elaboration?
Habil, you can unmute and speak.
Yeah.
Uh, Sorry, I don't have a camera connected, sir. But yes, I understood what the issue us, especially in India at this point, face. So yes, I agree. So we can do a blended mode where the data is stored locally, and when internet access is available, it gets uploaded, and then the algorithm updates itself. Yes, that makes much more sense.
Yes. That's right.
Habil
I
is
don't know.
our
I think the whole thing internet will be available. Habil, the thing here is I'm not using it there directly because the images will come to the main computer and then you'll be able to use it later and compared to the main technology.
Yes, sir.
Habil is our final year student, current final year batch.
Okay.
Yeah, B Farm, final year.
So what are you planning to do, Habil, after finishing?
So currently waiting on the final year results, sir. We are done with the exams.
But
No, I know, but what is your
future
plan for your life?
So I hope to pursue a master's in pharmacology.
That is okay. Then after that, I'm asking life.
Sir, that's a very profound existential question, sir.
No, but I want you to think now, no?
Sir, an area of interest of mine is to develop alternatives to animal testing. So use microfluidic models or human on a chip models.
Correct. That's what I asked. So that I think my idea is to tell people.
Dr. Neha only coordinated that event. So we are really having the opportunities when we are going online, as you say. Thank you so much for nice explicit answer. Thank you so much.
Thank you. This I'm showing the video, not video. This is Dr. Kalam visiting our hospital. I told him to meet all our staff. He did that. So this is Mr. Shivanandan inaugurating the van. And this is a motorbike project which we did first. And that's my 103-year-old grandmother, my late father, with opening the first motorbike in the world to take AI technology in the motorbike. And this is all I told you. I'm just looking for that video. So this is what we want to do. Prevention is better than cure. So this is a video which is again I will show you. The president of All India Ophthalmic Society. I would like to thank the International Advertising Agency for starting this competition for making a campaign on preventing diabetic blindness. And I also like to thank Allergan for the generous support to make this public initiative movie to create awareness on diabetic retinopathy and how to prevent diabetic blindness.
will forgive you. But will you forgive yourself? Diabetic blindness is preventable. If you're diabetic, you need a retina checkup to prevent vision loss.
So this we made as a public service initiative. And so that's what we are trying using the AI. Earlier we were doing it physically, and now we are using AI. And this is why the role of AI, sorry. So this is my famous slide, which I keep telling. Intelligence is what we need. Because forget artificial intelligence. I know I'm giving a talk on that. And intelligence is the capacity to analyze, think, make a decision, and categorize. So I had asked so many questions to Habil to ask for his aim in life. So similarly, everybody should question themselves for their own benefit. So we are using artificial intelligence, which involves formulating a specially made algorithm. So who will make the algorithm? Computer will make. But you have to ask the relevant question, whether you can use only the handwriting, or whether you are going to use the text, whether you're going to audio, video, or images. And according to our needs, and who will decide the need? Not the AI. We have to decide the need. That is why if you have that AI-induced, that either Alexa or Alexa keeps on asking me, do you want to know the weather? Do you want to have coffee? I say, you shut up. Because it keeps asking you, because that has been trained to find out at 5 o'clock you'll have coffee, or you're going to movie on a Sunday. It knows everything. And that is why it is dangerous. And there is made a movie on how a wife is complaining about a husband to the Alexa, and Alexa tells the husband. And it is possible because it records. And then finally, we decide our need to develop this capacity and include it in an electronic device like smartphone. And that's what I think we are here for. And we are now using it on which can be mounted. So I use this word, anybody can screen diabetic retinopathy. That means no need for education. And that is what I wanted to. We don't need that Romeo police in UP where they are taking stick and beating the young men looking at girls and all. I think both can be given work. No, both the male and female can do the retina screening. 77 million kabhi finish karega. And then you, by this way, you can also teach them to take diabetes medicine in time. That means pharmacist role is there. Then you teach them diet. So everybody will have a healthy diet, no? And then everybody will do exercise, which I do. And then you look trim like me, no? And my question is, I tell this because it's not boasting. I want to challenge the student. I can even walk daily 10 kilometers even today. I do that. So that's what I want to do. So this is a video which I wanted to show. I started showing everything. Where this is a phone which can be charged. This is iPhone 5, 6 like that. And the boy knows what to do. He focuses, takes the photo of the optic nerve, retina, and then he just puts it there. He tick marks it. That means he's applying to media software. And then it will say, see next. And the blue color which comes there is the artificial intelligence applied there. You can see there. And then he enlarges and checks. If you see there's a red dot, that is the hemorrhage. And that will underlined by the color difference by the computer. But same thing in a row, you'll miss 2 patients because your concentration goes away. It's not that you don't know. So doctor can make human error, or it is boring for the doctor. So, and then you can take all this, which can be done, and you can see there's a photograph taken fundus on phone and a 50 lakh camera. Well, a slight difference is there, but artificial intelligence can detect that. See, this is what the blue thing shows. The artificial intelligence picks up the color change, and that says this is not abnormal. So we have to label what is abnormal, what is normal, what is this, what is that. Then the computer reads and becomes. So who teaches the computer? We. So we are better than the AI. So AI cannot take over. And then even though in the movie, so we had the research question: is AI reliable to pick out those in need for seeing an eye doctor? Same thing, you have to put a question for your own pharmacy and then do it. And this is what we published: Diagnostic Accuracy of Community-Based Diabetic Retinopathy Screening with an offline AI system on a smartphone. And this is the best paper which has been quoted several times now, saying that this will be the future of ophthalmology in AI in the world. But can you believe that by the time this is published, we are now doing it as a routine with the BMC in Mumbai. The first of its kind. And then this is 4,000 views were there. Most of them in the last 6 months. Reliability is advantage of using AI is early referral of referable diabetic. So the eye doctor can spend only the patient who need this one. See, in the Dharavi clinic in 60 feet road, we have a pharmacy next door and also a ATM in there. So he also can do the diabetic retinopathy, which is what I'm trying to impress him, but he is not still ready. Anyway, one day all pharmacists will. So the trained and employed youth of India, even with minimal education, no experience in retina photography, to reach out to save vision of millions. Don't you think it's a great thing that we are using this AI with the ordinary human beings to do that? And independent of electricity and internet, and better time to the eye doctor for checking the patient, and timely treatment is preventing blindness. So I say, join hands for this monumental revolution, fight against blindness from diabetes. So I think there is a role. I'm glad you invited me to talk to the pharmacy. Pharmacy students have a role to tell every diabetic patient, are you a diabetic? Do you know you may go blind? Please show an eye doctor. You don't have to send the patient to me. Eh? No, I know I don't need patients. Correct? So thanks to my grandfather who was eye doctor, my father who was eye doctor, and we have done 130. So this is my famous slide, which is not missing in my presentation. Arise, awake, and stop not till the goal is reached. And I love Swami Vivekananda statue there, and that's why I love VESIT, because Vivekananda Educational Society, Institute of Technology, right? So I'm happy that I'm a part of all of you, and we are together. So I'm glad. I want to show this. Any other question? Only one student asked me.
So now you start loving not only VESIT, VESCOP as well.
Not only
VESIT. She says now you have to
VESIT,
remember
but
College of
VESCOP
Pharmacy also.
today I have to visit College of Pharmacy. Every time I pass through College of Pharmacy, and I think you also have Management College, I actually want to do projects with all the three institutes, engineering, management, and pharmacy, because one is I want to be young, so I'm young, and I want to be with the young friends. Because that's why Dr. Abdul Kalam said, either you read books or have a friend who reads a book. So I have a university as my friend, that is Shivanandan. He reads a book in a day. So he will tell me the gist, including Ikigai or the Chanakya, everything he reads and tells me. So same thing I want from students. Where I come, they will read and they will teach me AI, and I will use it in the field. And we should also publish together.
So, thank you, sir. Thank you so much for such an elaborate talk and taking each and every question, personally interacting with students, and our motive of introducing AI and its, application in the healthcare area, where you have given elaborate talk on application in ophthalmology, specifically in diagnostics, I think has helped the students. We are seeing less questions, probably because they are really not aware. They were really not aware before this session regarding AI. Now they are, and I think they will read more. We have sent them few review articles also on the same line. So yes, thank you so much.
I would appreciate it, because we always think we have energy, but I think you'll have double energy if you do a meditation. At a young age, it will improve memory. If you improve memory, you don't have to mug up. You can get more marks, get more grades, more job opportunities. Yes, madam. Yeah, madam.
Yes, sir. I really appreciate,
So I actually wanted you to send a mail to me asking me for that. Because I think by the next 4 hours, I'm in 3-4 conferences from China, America,
Yes,
and South America.
I get it. It was conveyed to me by your assistant that, I will
So send a question and a copy to Shubha. By Monday, I will send you those things. Exercise. Then in this COVID, everybody called COVID a problem. So I gave a talk, COVID-19 happy times. Where I've written a textbook. I've done some 100 webinars. Then I've done some 25 publications in world-renowned journals. Then whatever, and so many awards. All that during COVID. And then now I'm also operating daily.
Great, sir. Absolutely great, sir. So without taking further time, as I would get pinged by your assistant that you have another international meeting at 5:30 scheduled, sir, I would take this opportunity to especially thank you for sharing your knowledge on artificial intelligence and deep learning in ophthalmology. And your prototype, this Remedio fundus, and your extensive research in diabetic retinopathy, it has inspired us to look at the path of artificial intelligence, which is full of opportunities in terms of accessibility, affordability, and effectiveness, just like you rightly mentioned, sir. So, sir, thank you very much. You took out time from so much busy schedule and so nicely oriented all our students who are prospective students for this artificial intelligence course in healthcare. And you made time for us. We are very thankful. Please accept wishes from our principal, Dr. Supriya Shidai. She could not attend this session as she also has parallelly an exam as a yoga teacher certification. She has exam and she has conveyed her regards for you. Thank you very much, Dr. Natarajan, and thank you very much, Vijay Lakshmi ma'am, for organizing the session for us and communicating with Dr. Natarajan.
No problem.
I would now request Vijay Lakshmi ma'am to please tell our students about this course.
So yeah, sure.
Yes.
So thank you very much, Neha, Pragya, Supriya. I think Supriya is not there, and of course, Dr. Natarajan also. So when you came to me about 2-3 weeks back, so our principal madam, I want to thank, because she was the one who suddenly suggested, why not we involve Dr. Natarajan, because he is the best person when he's practically using AI. And for pharmacy students, I think the course is being focused on AI for healthcare. And when we talk about healthcare, doctors form one part of the ecosystem, definitely. But this is a system where the ecosystem has lots and lots of, cooperating sort of systems. Are you able to hear me?
Yes.
Yeah, sure, right? Yeah. So we have lots and lots of cooperating, you can say, subsystems, and definitely pharmacy, pharmacologists form a big part of that. And therefore, I think it's a very, very interesting and a very good initiative to think about introducing this concept of artificial intelligence to pharmacy students. So though we planned on this course for about 30 hours, right? The idea again is any new innovation or anything new should now come as self-learning and self-interest. And our aim for this particular course is that we just whet your interest, talk to you today, sir. Dr. Natarajan has very nicely given us a good introduction, and at least to one area, that is ophthalmology. But we hope to give you a bouquet of technologies and techniques. We are going to try to make it as non-mathematical as possible and more towards the algorithm and the application side, so that you can take this very, very powerful tool and probably use it in somewhere in your future. Very, very interestingly, I was just going through the Harvard site, Harvard Medical College site, and they are having something like 3,500 short courses, which are all dealing with AI for healthcare and different areas of healthcare. And they say that a healthcare professional now in these days is not complete without some knowledge of this concept of artificial intelligence.
Mm.
So what we are going to do in this 30-hour course with you all is, we are going to give you some basic introduction to AI, some motivation as to why. Okay, I am talking about it, but is it really true? Right? So you had one set of case studies, but we would like to take you through several well-known and let us say path-breaking case studies, which can give you an idea as to why AI is important for healthcare. The entire AI field runs around 3 or 4 different technologies. So one is what we call as basic AI. The other talks about what we call as machine learning, something called as deep learning, neural networks and deep learning. So in our course, we are going to introduce each of these topics, spend about 5 to 6 hours on each of them, right? And to give you an overview so that those of you who are interested, and if you are interested in a particular area, you can go ahead and then develop yourselves in that. Now, whenever we talk about a technology, very, very important are 2 things. I think sir would also agree with us here. One is I need to have data, because this entire concept of AI or machine learning or everything only works when I have large volumes of data. So we are also going to try and introduce to you where is it that you can get this data. You have lots of data available for research. So whenever you think of any type of new technology that you want to test on, right? So we are also going to try and talk to you about where are these health data sets coming from, where you can get them. And we'll also be giving you a very, very brief idea about what are the tools that are available, how you can utilize these tools probably on these data sets, and then get what it is that you want to. And we have formulated a 30-hour course. Each session will be of about 1.5 hours. So 20 sessions of about 1.5 hours. And I think we are starting on 24th of June, right? And except for a Sunday, we are running 3 sessions per day, and 3 1.5 hour sessions per day, right? So to cover this entire topic, so I have with me a team of professors who are well versed. I'm not going to call any of us experts. So we are well versed with this particular technology, and we would like to give it a healthcare bent, and we will like to introduce it to you all, right? Uh, I am also looking at the possibility that whenever there are case studies, maybe I can bring up one or two people from outside whom we know, who can at least give you a flavor for what are the type of case studies they have worked with using AI, right? So that is basically part of the course, consisting of basic artificial intelligence, machine learning, deep learning, and of course, AI software. And we are also going to you have a 4 or 4, maybe even 3 sessions talking fully about case studies, AI case studies in healthcare. So that's hopefully will give you enough information to go ahead. Now, this course is a very basic course, and I think the costing that VESCOP, VESIT, all of us together, so we are planning to charge you around 3,000 rupees for this course of 30 hours each. And I think the registration and the process would all be ready within a day or two. I think by Monday, uh, registration forms and yeah, the brochure, etc., will be fully ready, and it will be shared with you by your teachers and so on. We are also hoping to include other pharmacy colleges from Mumbai University to see how, and this is the first attempt based on how we go through this and the feedback that we get. So both institutes are very interested in having it as a continuous basis, and we want to keep it as a continuous learning sort of uh, endeavor for the students. So that is basically my just small introduction to this concept of AI. Yeah. So that's basically what it is. So if any other questions or anything regarding this course, one or two clarifications or something, yes, I'm willing to talk about it. Yeah.
Yes. Does anyone have any question? Any student?
Yes, ma'am, I have a question.
Yes, Tamanna.
So, ma'am, since you said this is like a basic course, so
Yeah.
after the course is over, like just in case if anybody is interested in learning a bit more, so
Yeah.
would there be any advanced course available for us?
Yeah, see, that is what, see, for us, this is also a first attempt. So I'm very happy that in the beginning itself, you are asking me that question. So we can go through the feedback, and we will also ask now, I think people in the feedback should take one more question, whether they are interested in an advanced course. So if there are some people, we'll definitely conduct an advanced course. But I will also here give you an assurance that if there is not enough people interested in an advanced course, see, we are sitting at VESIT. The faculty for this particular basic course, we are all sitting at VESIT. Our areas of interest are all coming from here. So we, at any time, we are always available to guide any student who wants to go a little advanced. And before I forget, I made a small, I missed this very important thing. Any artificial intelligence in the healthcare is basically not going to be complete if we don't talk about what we are now calling as precision or customized medicine, right? I think in the papers also you must be looking at genome based therapy and stuff like that. And for such customized medicines and etc. to work, we also need a couple of devices, right? And which in our jargon we call as IoT, Internet of Things, wherein each and every device is part of the internet. Everything. So we already know we have the Apple Watch, right? We have the we have intelligent refrigerators, we have washing machines which we can control from our phone and stuff like that. So we have a host of such healthcare devices also which work on this particular principle. So we are also going to be introducing the concept of IoT a little bit in this course. And coming back to your question, Tamanna, yeah, definitely, if let us say you are interested in something that is slightly advanced and you want to do some project on it to basically improve your knowledge or something, we'll be around to help you. Definitely we'll be around. Right? So
Thank you so much, ma'am.
Yeah, I hope that answers your question.
So Tamanna is a postgraduate student, madam. So she must be looking forward for her research work.
Oh, okay. Fine. Yeah.
Very nice question, Tamanna.
Yeah.
Anyone else? Okay, so
Ma'am, I have another question. I'm so sorry.
No problem.
Ma'am, so is there any availability? Like, if suppose we want to do anything like practicals or something while the course is on?
Yeah.
So
what we can do is, while the course is going on, though the course is not having any lab as such, because we are positioning it as an introduction. But yeah, when we take up that particular topic, when we are discussing with our team, we'll also talk about what can be the practical aspect, and if you want to do the lab, yes. And there is also one topic, the last topic is going to talk about AI software and platforms. And I think my team is already working on giving you pre-created labs. So even though we don't have a particular lab session as such, we are going to introduce that as a lab session, wherein pre-created labs are going to be given to you, and you can play around a little bit if you want to. Definitely.
thank you, ma'am.
Yeah.
okay, so this will be all, and we will shortly share the brochure with all of you, and then you can do the registrations as mentioned over there. Madam has already explained you about the costs of the course, and I request you all to fill the feedback form which is shared in the chat box of Pradnya Madam. This will also give us a fair idea about how many students are interested in the course, and so here we sum up our session, and again I would like to thank the organizers from VESIT. I see Nair Madam is also here.
Yes.
Thank you very much, Nair Madam, for attending this session. I just saw in the participants that you have joined. Thank you for your time. Are you there, Nair Madam?
She was there. That I was.
Okay, she was there. Okay,
Yeah,
thank you. Yes, thank you. And thank you very much, everyone.
Yeah.
Yes.
Yeah, we thank we thank Natarajan sir again. We thank Vijayalakshmi madam for her time and precious guidance given, and giving a very good, clear guideline regarding the course. I think students are now do have more clarity about the course, right? So thank you, madam. I thank Principal Madam, Principal Dr. Supriya Shidaya Madam. I thank B.L. Bulani sir for though he was not able to connect with us via internet, he telephonically personally called me and conveyed the message. So I thank him. I thank IIC team also for backing us up. So thank you so much.
Mushtaq sir is also here,
Yes.
President IIC, and Vice President Dr. Anita Aire is also here, IIC with us, and thank you for all this.
Yes. So we thank them also.
And all the participants.
Thank you, Rajashri Hilekar Madam, for her active participation. And thank you, participants. We look forward for your for having more interaction, and we look forward for course registrations. The only objective is to getting you through this particular area and take you into this area so that you can explore more. Thank you so much.
Thank you.
Thank you very much, everyone.
Thank you.
Thank you, everyone.
Thank you, all of you.
Thank you, sir. Thank you, sir. Yeah. Thank you, Dr. Natarajan.
Thank you, sir. Thank you
It was
so
a great,
much.
great pleasure to interact with you.
Sir. Thank you all.
Thank you.
Thank you.
Thank you so much. Thank you. And thank you, students. Thank you, sir. Thank you so much. Namaste.
Transformation, we're catching it very early on, and so that was one.